Business in the 217 on the WMAY morning news feed. I'm Greg Bishop. We're joined now, Springfield Clinic doctor Richa Pandey, to talk about something people may not think about. You're always concerned about your heart, concerned about your lungs, you're concerned about your mental health. But what about your kidneys, doctor? Tell us more about World Kidney Health and awareness and all the things that people need to know about their kidneys.
Yeah, thank you for having me. March is National Kidney Month, and we are trying to encourage people to have a conversation about their kidneys, learn a little more about them, and see what they can do to prevent having kidney disease. Your kidneys are as big as your fist. They are small but mighty and extremely smart. They get rid of all the salt and water and toxins that your body does not need. They clean out your blood, and the way we know how good your kidneys are doing is by certain blood tests and certain urine tests. You could be at risk for having kidney disease if you have pre-existing conditions like diabetes, high blood pressure, or heart disease. 1 in 3 Americans is at risk for getting kidney disease. So, 33% of the people in America are at risk. At this time, 37 million people are suffering from some form of kidney disease. You have over 600,000 people who have complete kidney failure and 100,000 people who are on the wait list to get a kidney transplant. So these are staggering figures. And a lot of times when you do get kidney disease, there is no turning back. So what I want to emphasize on is prevention and actually taking care of your kidneys so you don't get kidney disease.
One of the elements I would imagine is being able to have proper screenings, but that includes going to the doctor and having those kind of baseline measurements, and then being able to assess moving forward. Talk about the importance of people, not just with kidney health, but with general whole health. The importance of visiting the doctor on a regular basis.
So I think there are different guidelines for this, but if you do have pre-existing conditions, such as any chronic illnesses like diabetes or high blood pressure, at least once a year, you should be seeing your primary care doctor, sometimes even more than that. If you're taking any sort of prescription medications, you should have blood work done to make sure your kidneys are doing okay with that. Learn about the test results. So the kidney function is measured by this number called the serum creatinine. It's a muscle breakdown waste product. So anytime you move around or use your muscles break down and form this chemical called creatinine, which your kidneys end up eliminating. Typically, a normal creatinine depends on what your muscle mass is. So my creatinine might be different from yours, but the range is typically 0.5 to 1.0. If your creatinine is higher than the range for your age, that would reduce your total kidney function. That is actually something called GFR, glomerular filtration rate. Now, depending on your age, the normal values also vary. But if your GFR is less than 60, you're already at stage 3 kidney disease. I can't tell you how often I see people surprised when they say that I have been in stage 3 kidney disease for 5 years and I didn't even know about it. And that is probably one of the most difficult aspects of having kidney disease, is how asymptomatic it can be for a very, very long time. So it's important to understand your labs. Please take a look at them yourself and understand what they mean and ask questions.
It's Business in the 217 here on the WMAY morning news feed. We're talking with Springfield Springfield Clinic doctor Richa Pandey about World Kidney Day and World Kidney Month and the awareness that you need about your kidneys. You said there's a lot of, I guess, not a recognition because there aren't many symptoms that will show, but surely there's something people can kind of, a feeling they may have or a pain they may have that could at least lead to some recognition of what's going on here. What are some of the signs they should look at outside of just looking at the test results?
No, definitely. I think there are some early signs that you definitely need to look out for. So if you have swelling around your ankles, if you have swelling around your eyes, if you can see obvious things like blood in your urine or bubbles in your urine, if you are tired more than usual, or if you have problems with going to the bathroom, or if you're waking up a lot at night to go to the bathroom, all of those things could be indicative of early signs of chronic kidney disease.
Of course, having those regular visits with your doctor and having the proper tests done, very important. Who's at risk for kidney disease? Is it an age factor, or you already touched on some of the underlying conditions there may be? But is this something that everybody across the spectrum really needs to be cautious of and cognizant of?
I think I'm happy you brought up the age factor. Definitely above the age of 60, you are at higher risk for having chronic kidney disease. But if you take over the counter medications on a regular basis, such as some painkillers or acid reflux medications, you could also be at risk for having kidney disease. If you have any family member who takes dialysis or has been diagnosed with kidney disease, you are also at risk for having chronic kidney disease.
Some of the methods to, I guess, in a way, fight against kidney disease or to address kidney disease. Talk about some of the tools and the new technologies that there are to help people live with and probably negate kidney disease.
So I think in 2021 we have made such positive strides towards improving quality of life on kidney disease, and I'll be the first to tell you that doing dialysis is a very very poor quality of life. But even compared to where we were 6 years ago, we have made positive improvements, and we have actually come a long way now. You can do dialysis at home. You can have a kidney transplantation with shorter wait times. There are clinical trials ongoing right now for a bionic kidney that can be implanted. So you don't have to take dialysis. You can take an implantable kidney. We are several years away from it, but it's a great start, and I'm really encouraged by it.
Yeah, there's obviously some pretty incredible medical advancements that are happening that people definitely need to be aware of, and it's just a testament to the work that all the medical community does across the world. Springfield Business Clinic, Dr. Richa Pandey, with us here on the WMAY morning news feed for Business in the 217. And then finally, here, what kind of prevention steps can be taken? Is it a matter of diet? Is it a matter of exercise? Is it just a matter of making sure that you have those regular visits with your doctor?
Absolutely. I always say this: be the best version of yourself that you can be. Have at least 60 minutes of exercise 5 to 7 days a week. Eat from all food groups, eat a good, well balanced diet. Make sure that you're staying active. If you do have high blood pressure or diabetes, keep an eye on those numbers. Be responsible. Make your charts and logs at home and take it to your doctor. Avoid any over the counter medications. If you don't have to take any, I would highly recommend backing off. If you do smoke, understand that people who smoke are at extremely high risk for having chronic kidney disease and other vascular disease, actually. So, this might be a good point for you to reconsider and stop smoking. And if you have family history of kidney disease, or if you take over the counter medications or any prescription drugs, please get tested to see if you have chronic kidney disease.
Well, and these all sound like just general rule of thumb, good health habits that people need to maintain. Business in the 217 with the WMAY morning news feed. Dr. Richa Pandey, thank you so much for taking time with us and telling us about World Kidney Day. If people need to get more information about this, where can they find it with the Springfield Clinic?
Yeah, reach out to us at the Springfield Clinic main line at 217-528-7541.
Very good. Doctor, thank you so much for taking time with us and telling us about our kidneys and the importance of understanding why we need to get regular checkups and how we can listen to our own body and take care of ourselves so we can all have a much more healthier and prosperous life. Have a great day, all right?
All right. Happy World Kidney Month. Thank you.